Well, good afternoon, everyone. I'm Brenda Metzler with Let's Grow Kids, and we are pleased to welcome everyone to this conversation with the whole team of health professionals and Jess Lucas who is the aquatics director at the Burlington YMCA. We have much to celebrate at this time of year. It's the end of the school year. It's the beginning of summer in Vermont. Oof. And COVID vaccines for children, the youngest children. So I'm just really pleased to be here with everyone. And today our health professionals are going to talk to us about water safety. We're going to hear from the epidemiologists. We're going to hear about COVID vaccines for young children, and we're going to get an update on testing. There will be time for Q&A. Please hold your COVID-related questions during the presentation part, and then you can drop them into the Q&A box after. I think sometimes what happens is we have so many questions, and then we're like intent on getting them into the box, and we're actually missing the presentation, which might be answering our questions, so hold those. And we're also planning, just know that we're also planning for another conversation with this team in the very near future about those new vaccines. So once we have a little more information about them, so keep your eyes open for that. I'm going to welcome Katie and Molly and team right now, and I am going to listen and learn.
Hello, everybody. Like you see, we have a great team here. We have Molly and I, and we have our pediatricians. We've got epidemiologists and vaccinations, as well as water safety. So we have a really great team here to present. So, even as this year has seen major changes in our response to COVID, we're still dealing with its restrictions and its impacts, especially in the under age 5 group. So as school is finishing and we're reflecting on the year, we definitely recognize that for you, there is no wrap up. Child care providers are continuing to provide support and services through the summer. So you've maintained your essential businesses through these trying times, and we are so thankful for the work you do. So today we're going to start off with a presentation on water safety, and then we will shift our focus to COVID. So like I said, we have updates from our colleagues in epidemiology and immunization, and we will be answering your questions. So we're going to have short presentations from all of these people. We're going to answer the pre-submitted Q&A questions, and then we're going to go through the questions submitted during the webinar. And anything that we don't get to, we will answer and email back so that Let's Grow Kids can message us out to you. So like Brenda said, so please hold the COVID-related questions until after the water safety, and then we'll go through all your questions. So Jess Lucas, would you like to offer us your tips?
Absolutely. Good afternoon. I'm Jess Lucas. I'm the aquatics director at the Greater Burlington Y here in Burlington, Vermont. I've been here for just a couple days, over 12 years, employed by the Y for 25 years. So I'm super excited. Thanks for having me today. I grew up obviously swimming actually here on Lake Champlain. And then today, my love of water just continues every single day, which is great. But this time of year, I start to get super, super nervous. As we say here, the world is 71% water, but kiddos are 100% curious. And it's like that all of the time, but especially now when there's no more ice and we're all outside playing, my anxiety about what happens definitely increases. So hopefully we'll be able to give some tips. I can answer some questions, but my goal is to just sort of talk about and share some information. I get super nervous because children have outgrown last year's life jackets. Inexperienced swimmers, they haven't used their skills in months, perhaps even a year. In addition to that, because of the pandemic, swim lessons have been few and far between for the past 2 years, and our community is recognizing that, but we're still sort of trying to make up for lost time. The appeal of swift water in our area, rock ledges, the swimming holes, it makes those things very dangerous. And then a lot of our local beaches and pools don't have lifeguards regularly. And so there's just a lot that we need to think about. So I've got a little slide presentation to start. So if we want to get that started, we can go kind of right to the second slide. And so here's a list of places, and we can just prompt all the places that we can swim here in Vermont. So as parents, as babysitters, aunties, childcare providers. You've got a variety of places to swim here. And even though we don't have an ocean, we've got just about everything else that we need to be careful for. Next slide. Here are some of the most dangerous aspects of swimming. Some things we think about and talk about regularly, like a slippery pool deck. You don't run near the pool, you don't run near water. But then when we're at the beach, we run. And so if we're 2 years old, that can be a little confusing. We want to be mindful of the differences in bodies of water. Also, deep water, shallow water, that terminology for some folks in our community can be new words. So with kiddos that we're working with and even adults, we want to make sure people understand. It's easy for me to say, well, this is the shallow end and that's the deep end, but some people don't understand what those words mean in terms of depth of water. We also want to be careful, some first aid pieces, muscle cramps, being in the sun too much. So these are just some of the dangers of swimming. Next slide. This is a great piece. The Y partners a lot with the Red Cross when it comes to a lot of things, but especially water safety. So this is sort of what we call the circle of drowning prevention, and some tips, some things that we want to see. The biggest thing is having someone that we call a water watcher providing constant supervision. And that's just not for kids, it's for adults too. Muscle cramps, for example, are more likely to happen to adults than children. So you want to make sure that we always have somebody watching that water. If we've got non-swimmers, they're in a Coast Guard approved life preserver. We'll talk a little bit about the puddle jumpers that are a bit newer on the market. And then also make sure that if people have home pools, I know that we've got not a ton of backyard pools, but we do have a good number here, that they are fenced in appropriately. And then obviously learning, you're not, to be safe around water, you don't have to be an Olympic swimmer. You just need to know the rules and certainly teach them to younger kids. Next slide. And then, gosh forbid there is an emergency, this is the chain of what can happen to hopefully have tragedy not happen. So we want to make sure that we know what we're looking for if somebody needs help in the water. We talk a lot with children about reaching, throwing, don't go. Adults, however, might have the ability to get in and help somebody. It really depends on what the situation is. Making sure somebody's available to call 911. Those who have CPR training know you want to make sure you point, you designate to make sure that phone call has been made. And then obviously CPR. And so the more folks that know CPR in our community, the better to hopefully prevent a tragedy. Next slide. So yeah, super, super fun. These are just two examples. I need to update the photo a little bit for our new pool behind us. This is at our old building down the street. But then, we have a great area to swim in. And so I don't want to take the joy out of it for people, but I want to make sure we're doing it safely. So next slide. I mentioned reach, throw, don't go. This is something we really try to instill in our kiddos in swim lessons here. You want to take something, you want to reach it to them, you want to throw it to them, you don't go yourself. If somebody is scared in the water, they're going to try to grab on to the person helping them. And kiddos grabbing onto kiddos is just gonna end, unfortunately, probably with 2 tragedies. So this is a little phrase that, it's catchy, people can remember it. I was just down at Oak Ledge Park a couple weeks ago, and I see now that round red ring buoy, they actually have one of those permanently installed, which is a really great addition, to try to make sure people know what to do and that you can help even by not getting in the water. It's actually a bigger help because you're keeping yourself safe to call 911, yell for additional help. But reaching, throwing, and not going is so important. And I would add to that, really yell loud first for a grown-up to the kid. That should be the first thing they do. Next slide. Some things to think about. We talked a little bit about muscle cramps. Here, I don't know if anyone's noticed, my iPhone weather app lately for a long time had a cold water warning. So when we were 70s, 80s into the 90s, over the past month, it said weather warning. I'm like, what are we talking about? And every time I went, it was still that cold water warning. So in our community in the spring, this is a big conversation to be having with people, and even not in the spring. It stays chilly. People go to Maine. It's really cold all year in Maine. So we want to make sure that we're being careful of water getting too cold, also people getting too cold. Here after it rains, being caught up in currents. This especially applies to the swimming holes. After it rains, that water's running so quickly. We want to be careful about the currents in the running water. And then when we teach safety skills here at the Y, we focus on back floating. So that way folks know how to rest, they know how to yell for help while they're in the water. So just some little tips to make sure that people can stay safe once they're in the water. Next slide. I like this pictorial because we have so many what I call natural bodies of water or open water where we can't see the bottom. So we just want to make sure that we kind of examine the bottom before we go in, not only for hazards, but also to know the depth of the water. You want to make sure if there's a big drop off that people are aware of that. They know the swimming parameters. If you're swimming in open water, it's important to have markings for that. You can go to the next slide. This would be an example of those markings. So that way kiddos and even adults are not swimming outside of a boundary. And it could be because the water gets deeper. In this situation, it's probably deeper water, but then also within the lifeguard's area of scanning and surveillance. So it's something important to know what is the swimming area and have that marked off, ideally with a physical buoy rope, if not with adults stationed in the water. Next slide, please. And then I always like to do the sunscreen one. It's something that I kind of forget about. You're having so much fun in the water. So we want to remember to always make sure that we take a break and that we reapply sunscreen, we hang out, take a rest to just get our energy back up and have some food so that way we don't get cramps with some water. Next slide, please. These are a few things that are really, really important. It seems pretty basic, but it's hard when you're packing up to head towards water. You don't always remember everything. The first and foremost important thing is a lifeguard. And if you have the ability to swim somewhere where there is a certified lifeguard, that's going to be the number one thing. Beyond that, if there's not a lifeguard, or even if there is, you want to look for other things to keep you safe. So we talked about the ring buoy, a Coast Guard approved life jacket. The little blue alligator is a puddle jumper. That's a new piece of equipment on the market. It's great. The weight is 30 to 50 pounds. So it's important to make sure that you've got appropriate kiddos in those. And they often, once they get worn, they'll kind of rip under the arm pieces. So just make sure that they're in good condition and working. But those are Coast Guard approved. There's another example of a rope, and it's at the 5-foot section. So that's going to be distinguishing shallow end versus deep end. You have your markings in a pool with how deep or shallow the water is. That's super easy. Out in open water, a little bit more difficult. And then obviously a noodle. I appreciate having a noodle. I share the story that I spend time down in southern Vermont on Lake Champlain, and I swam across a bay with my uncle. And I was like, you know what? I'm just going to take some noodles in case one of us gets tired. And he's like, well, we won't. He barely made it one way across because he got so cold. And he ended up having to walk a mile back to the house. And I'm really thankful that I had those noodles to help him finish getting across. And he's a very experienced swimmer. He just got really cold. So no matter how strong and experienced of a swimmer you are, it's important that if you're going somewhere, especially if someone's not directly watching you, if everybody's involved in swimming with you, that you have extra flotation. Next slide, please. And then, as I said, I love the lifeguards. Here in Vermont, they come in many different kind of forms in terms of not the traditional red. A lot of states you see all red. Here in Vermont, we can kind of wear whatever we want. So it's important to make sure that people know where the lifeguard is and can identify that lifeguard, because it might not be the traditional red rescue tube, red chair, red shirt, red hat, red whistle. Next slide, please. Again, some pictorials. Part of the reason I used all these is I have access to these. So anyone who would like these, I can distribute those out. I'm a big fan of pictures because they just sort of, say a million words in one. Next slide, please. Then lastly, I obviously like to plug swim lessons, not just because we do a bunch of them here, but it's going to be a huge, huge chain of allowing people to be safe around the water. So this is a list of people who I know are currently doing swimming lessons. Unfortunately, many of them are in Chittenden County, but we can figure out if people have questions about where to go for swim lessons. We can figure out places in other areas of the state. But it's so important to get kiddos into swim lessons, even adults. It's never too late to learn how to swim. But this is really what's going to keep everyone safe in our community around water. Next slide, please. So that's it. So I appreciate your time. Certainly have time for questions if people have questions.
And I'll also say, if we end up having water safety questions, we can also address them when we do the Q&A at the end. I don't see any in there right now. So I think in the interest of time, we'll go to the next piece of the agenda, and then any water safety questions during the Q&A portion, we'll throw right your way. Thanks so much, Jess.
Sounds good. Thank you so much, Molly.
Yeah. All right, Allison, do you mind giving us a little epi update?
Thanks. Well, it's hard to follow water safety because water safety is always more fun than epi, I have to say. Who wouldn't rather be in the pool? But we just have a short update for you. It's really an exciting time in epi because we got rid of the COVID dashboard and replaced it with something I think so much better. So I just wanted to tell you what we replaced it with, which is our surveillance report, which I think is so much more helpful in this stage of the pandemic. We used to be obsessed with case counts and how many cases there were and all of that other stuff. And we're really transitioning to a phase where that's not the best measure we have of how we're doing as a state with COVID. And so we needed a report on our dashboard that reflected that so that we could better assess where we are at with COVID, and our new surveillance report does just that. So if you go to where the dashboard was, you'll now see that once a week we update it on Wednesdays with the surveillance report, and it looks at hospitalizations, syndromic surveillance, wastewater treatment, wastewater treatment centers to look at what variants they're seeing there and what levels. It also does have a section where we look at vaccination rates, and it does show case counts, but that's just an insignificant portion. The parts that we're really following are the hospitalization, wastewater, and syndromic surveillance to really give us an idea of how our hospital capacity is and how we're doing overall as a state. And people say, well, then how will you know if there's a new variant? Wastewater is really great at telling us if we see new variants. We also are doing some testing still. Hospitals still do testing. So I think there's lots of ways, but I think it just represents an important shift in the way we need to think about COVID. And I think that's also, I know change is hard, but I also think it's an exciting time because it really shows how far we've come as a state with vaccination and just with COVID in general, that we're ready for this step. So I'm happy to take questions on that, but really that's all I really wanted to point that out. So as you saw that change, you knew that was something we had moved to and we're really excited about presenting for you today.
Okay. Sorry. Okay. So Monica, do you want to jump in? The pediatric vaccination conversation? I think you need to put something in the chat because you're muted.
How about now?
Okay, there you go.
There we go. Okay. Brenda had to hook me up because Zoom and my computer don't get along. So exciting news out of the FDA and hot off the presses yesterday. The FDA did go ahead and, an independent advisory committee that supports the FDA did go ahead and approve the emergency use authorization for 2 products for our youngest cohort of kids for COVID-19 vaccination. The first is, oh, that's right, I forgot I prepared slides. I was on my game today, yesterday. So the first is a product out of Moderna, and this is going to be a product for kids under the age of 6, and they approved a 2-dose series for kids 6 months up through the age of 5 years old, less than age 6. They also approved a product from Pfizer for children 6 months through 4 years of age, so less than 5. And that is a 3-dose series. Of note, there's a lot of conversation about Moderna actually end up being a 3-dose series, but that is still, that data is still in progress and would still need to be submitted. But for now, the Pfizer under 5 is a 3-dose series. The Moderna under 6 is approved for a 2-dose series with a likely 3rd dose coming. So what that means for next steps, next slide, please. There's still another round of review to happen. So tomorrow, Friday the 17th, and Saturday the 18th, ACIP, which is an independent advisory committee that supports the CDC, is going to be reviewing everything that the other independent advisory committee group reviewed, and they'll vote. After they vote, the CDC director will issue a formal recommendation based on everything that the 2 advisory committees heard. It's likely that since things have already gone through VRBAC and are going to progress to ACIP, that we will see a vote in favor for making a formal recommendation for the use of these 2 products. So even though an EUA has been approved at this moment in time, we can't be administering this vaccine until the CDC director has actually made an official statement. We suspect the earliest that she would do that is Saturday, after the vote has occurred by ACIP. However, for the past few weeks, we've been working on making sure that vaccine for this age group is pre-positioned throughout the state. So vaccine pre-orders were actually placed the 6th and 7th of June. So pediatric healthcare providers, hospitals, EMS providers, offices of local health and district offices have already placed their vaccine orders, so they know exactly how much they're going to get. And what's still a little bit to be determined is when exactly they'll get it, because that vaccine can be shipping out really any day now up until Saturday when the vote occurs. But the good news is, broadly speaking, vaccines should be widely available throughout the state by the end of June or early July. Next slide, please. So let's talk a little bit about specifics about where these kids can get vaccinated. Primary care providers are going to be the primary group of deliverers of this vaccine. And we know that this age group tend to go to their primary care provider often. Many of them are already deep in their routine vaccine, childhood routine vaccines. I know my 5-year-old's got an appointment next week for all of her pre-kindergarten vaccines. And so we know that families are going to have a lot of questions. They're going to want to talk to their healthcare providers about vaccine, how to fit this into the routine schedule, and anything else that might be on their mind. So we're very fortunate that our network of pediatric healthcare providers in Vermont were staunch advocates to make sure that they had this vaccine in office right out of the gate because they knew families would want to get it there and talk to them about it. We will also have vaccine at our WIC offices, so families enrolled in WIC clinics can go and get vaccine there. It's just an added layer of access. They will be proactively outreached by their WIC office on or around June 21st. So that's next Tuesday. So they'll actually be hearing from the WIC offices about what the plans are in order to access vaccine at their office. So it doesn't mean they have to go there, but we're hoping that this can create a little bit more diversity in access so that not everybody's relying on the pediatric primary care offices. And also, if WIC families need to access something else through their WIC office, they can do that at the same time. We'll also be offering the same health equity clinics that we've been offering throughout, and we're also exploring a few more with some community partners. These tend to be promoted by organizations within the community, such as the Vermont Health Equity Initiative. If you follow them on social media, they've been doing a really wonderful job promoting clinics. AALV and NAACP are other great partners that have been promoting these clinics and opportunities. And then some pharmacies will also carry this vaccine. As a reminder, pharmacies can only vaccinate children 3 and above. So we're starting to see that pharmacies are ordering some of this vaccine, so there will be additional access there, but we think that it will probably be much less than, say, previous rollouts of other vaccines. And then there will be small walk-in clinics statewide that are promoted on our website. And if you look to the right of the slide there, that's just a quick screenshot of what it looks like. So you can sort by date, you can sort by site, sort by time, and then all the way on the right where you see the vaccine types, we'll actually be adding both. It'll say, I think, Moderna less than 6, Pfizer less than 5. So you'll also be able to sort by vaccine type there. But that will be up on our website as well. And again, those are walk-in clinics offered through our network of EMS providers throughout the state. And those sort of like move all over the place, which is really great in order to meet geographical gaps and needs in different communities. And I will put in a plug that our EMS providers are really mobile and nimble and flexible and very excited to partner with organizations around offering clinics. So while we know that we can't come into, say, a child care provider's space and offer vaccine clinics, if there was interest in partnering on a clinic for the families at a center that you're involved with, they would be delighted to do that and to think creatively with you about how to do it. So you can absolutely reach out to me if that's something that might be of interest. And last slide, please. Here's our one plug or idea for you. We know that child care providers are very trusted sources of information for families. We developed a toolkit at the health department that has some information and some pictures that you could use on social media, or if you wanted to email your families that are enrolled at your center and just share some general information with them about, that vaccine is available through their pediatric healthcare provider office, or if they're enrolled in WIC, that they can, get access to vaccine through their WIC clinic. There's a link here to a Google Drive, and if you click on it and don't have access and ask for permission, we'll give it to you. But there's language there in case you want to promote any of this information to the families that are enrolled in your clinic. And we really appreciate your interest in this topic and helping us share this information with families. So that's really it from me, and I'm happy to answer questions now or during Q&A whenever Molly and Katie tell me to.
Thank you, Monica. We'll probably just have all the questions at once just to keep us in some sort of order. So I'm just going to give a quick update on testing for everyone. The state-run testing is going to be ending on June 25th. So now's the time to check your test supply. Go pick up extra tests for yourself. Encourage families to pick up tests for themselves as well. And we just want to talk a little bit about looking to the future and thinking about moving out of the pandemic and kids being able to be protected by the vaccine. As that happens, we anticipate we're going to be relying less on testing as a main strategy. And so we want to encourage you as well to shift your focus away from testing and think about how you want to handle sickness in your program moving forward. And when thinking about these these sickness policies, we really want to encourage you to align your policy with Department of Health recommendations. We want to ensure people are safe in childcare, and we also want to avoid policies that are more restrictive than public health recommendations, which can really create barriers to care and economic hardships for families. So as we learn more about testing, we will let you know, but that's just kind of our little blurb for today, and we'll shift into the pre-submitted questions, and then we'll look to the chat.
Okay, and Brenda had just posted as well that she'll be sharing all the slides on the website, so any links will be there, and we also send out links after this too, so everybody will have access to all of the resources we're talking about today. All right, so the first pre-submit question is, could we get a flow chart recommended by you, not mandatory, or a cheat sheet to use to determine when children can attend? Can you provide a sample COVID policy just for childcare providers, not the general public, to use as a guide for creating our own policy? So something already exists. We have the sample childcare sickness policy. It's currently on the Department of Health COVID childcare web page. So it's just a suggested policy that you can review and adapt based on the Department of Health recommendations. So whether or not you choose to use this policy, we did want to just remind you of the basic recommendations when it comes to COVID, because we know that they have changed over time. So we encourage you to align your policy again with these recommendations. So for COVID exposures, if a child or a staff member is up to date with their vaccinations, they only need to test if they develop symptoms. If they're not up to date, then you can either take 2 serial antigen tests starting on day 4, or a PCR or a LAMP test on or after day 5. And then if you develop symptoms at any time, it would be another time to get tested. Testing is something that we are recommending but not requiring. And then as a basis, quarantine after COVID exposure is not currently recommended or required. For a positive COVID test, so that we know a confirmed case of COVID, we are asking people to stay home and isolate for 5 days. You can leave your home after day 5 if your symptoms have improved and you've had no fever for at least 24 hours without the use of medication. And we are definitely emphasizing that testing out of isolation is not recommended or required. So the isolation for 5 days is sufficient.
Now let's forget to unmute. So the next question is, confused especially about what day a child under age 2 should test after exposure to a COVID positive individual or after testing positive to end quarantine early. Is it a 10-day quarantine or 14-day quarantine required? So for anyone who is not up to date with their vaccines, regardless of age, the guidance on Department of Health COVID close contact page states, no earlier than day 4, take 2 antigen tests 24 hours apart or longer, or on or after day 5, take a PCR or LAMP test. If you develop symptoms at any time, get tested. So antigen tests are not approved for children under the age of 2. So they should be getting a PCR or LAMP, they are not approved for LAMPs as well. So they should be getting a PCR test on or after day 5, or as soon as they become symptomatic. And again, this is a recommendation. It should not be a requirement that they get that test. And the other piece of this is that we're not recommending quarantine at all. So it's not recommended, it's not required. The difference would be if they're symptomatic, then they should be staying home to get tested. But as far as a standard quarantine, that is not recommended.
Okay. I was told to have a child under 2 who tested positive take 2 antigen tests on day 7 and 8, about 24 hours apart, at the pediatrician's office to return. So this is a child who was positive for COVID. So, again, it's important to note that antigen tests are currently not approved for use in children under age 2. And then if the child's symptoms have improved and they've had no fever for 24 hours without the use of medication, according to the Department of Health guidance, they may return to care, and testing out of isolation is not recommended.
Had an under 2 child test positive on day 13 after a 10-day quarantine. They opted not to test in quarantine 10 days. Very concerning. Should it have been a 14-day quarantine? So what I'll say to this is, unfortunately, I don't have a good answer because there's a lot of gaps in that question as far as the situation. It's one of those things where we would need a lot more details, but the big reminder is that quarantine is just not required or recommended at all. As far as the other pieces, I really can't say much because there's a lot that I don't know about the situation, but the biggest thing is that we are not recommending or requiring quarantine. Allison?
The only other thing I'll add now that I hear you say that question out loud is that potentially the person is concerned that they didn't stay home long enough, though we don't require them to stay home at all. They could have had another exposure along the way. Do you know what I mean? Like, so that initial exposure 14 days ago may not have been what made them positive on day 14. So I don't want you to think that it necessarily took that long for them to turn positive, because there's no evidence that that's necessarily the case. So just, although we don't know the details, I'll just put that out there as consideration, that a 14-day quarantine wouldn't have necessarily prevented that either.
Thanks, Allison.
So, sorry, Katie, this is a good reminder to folks that if you have medical providers in your community that are providing advice that's different than you're hearing from the health department, and that we're slowing down and just methodically taking you through like day 4 and someone's telling you day 7, that's a terrible position for you to be in. I just really want to acknowledge that must just make your head spin. So I would really encourage you to reach out to this team, Becca, Brina, Katie, Molly, Allison. We really care about that stuff. We're a small enough state that we can manage misinformation, different interpretation of guidance. You know, we're in yet another phase of kind of talking ourselves through each of these questions, and we want to support you and the medical community that you're working with, because it's pretty variable, and that we're just acknowledging.
Thank you, Brina. That's so true. So true. Everything has been changing, and we're trying to, everyone's trying to keep up with sort of what the latest is, and then that conflicts with sometimes other things that you're hearing. So that's really good. And we love, again, that feedback so that we know where to sort of target some information. All right, so can we have a monthly or at least bi-monthly check-in call with you regarding COVID? Feel really overwhelmed trying to figure everything out on my own. So we are currently developing our schedule moving forward for calls, and want to assure you that we're committed to continuing these calls. It's a confusing time. We all know that, and we really want to be able to support you however is helpful for you. So the thing to remember also is you can always reach out between calls. We are here to support you, whether or not it's during a webinar. And so we also are, I think that Brenda mentioned, we're considering having another call in a month or so to have a more in-depth discussion on the pediatric vaccinations and how to support that piece. So more to come on that as far as the schedule goes.
If state testing sites are closing, where should we be directing families of children under age 2 to be getting PCR tests? Right now, testing results are coming in quickly. We're afraid it may take longer if the only option for families to go to is their pediatrician. Absolutely hear that one. So currently, the plan is directing people to either their primary medical provider or a pharmacy, but these are conversations that are still happening. We absolutely understand the concern with that turnaround and making sure people are able to get those appointments quickly. So that issue is identified and it's being discussed. Unfortunately, I don't have here's the solution, but I do know it is something that's being actively looked at because that's absolutely a very valid concern.
Yeah, we're really seeking to prioritize this age population to keep them in mind when we're figuring out the solutions. So the next question, can you speak to the cost equity issues that may arise with testing happening through healthcare providers only rather than through free testing sites? We are seeing accessibility issues with those not insured or underinsured seeking PCRs for children under age 2. certainly a good question, especially with the uninsured or those people that might not have a primary care in place already. So health equity and access to testing, it's definitely continues to be an important priority for the health department. As we're shifting away from the state-run testing, we want to ensure that there's still equitable access to affordable testing across the state. And so the health department leadership is meeting frequently with our MCH director, maternal child health director here, to develop a plan to meet the needs of our communities and to keep children and families in the focus as well as these decisions are being made. And although it doesn't help with children under age 2, please encourage your families to check their test kit supply, access additional test kits prior to the state sites closing on the 25th, and ordering kits from the federal government, which can be mailed directly to them. So really encouraging them to stock up.
Are there any thoughts on how general licensing health guidance may change for COVID and non-COVID illnesses / symptoms in the future? So a reminder that the licensing health guidance is a minimum. So likely the minimum isn't going to change a great deal. You know, we still want children to be able to access care while keeping major illnesses out. It's, as we've seen throughout the pandemic, it's really hard to predict what's going to happen with COVID as far as testing and treatment and what that will look like. But as public health recommendations change, we would encourage childcare to use those recommendations when creating their policies, but that doesn't necessarily mean that that basis of the regulations themselves would change.
Okay, this is the last pre-submitted question, and then we'll just turn to the questions in the chat after this. So will the vaccination status change any of our procedures? So if a child is up to date, they will no longer need to test after COVID exposure unless they have symptoms. So that will be the major change there, similar to the way it is for adults. So other than that, it will likely remain about the same. So.
All right. So I know Jess has been able to answer questions in the chat about private swimming, finding lifeguards, about resources to share with families, and the Google link has been added. So if you go to the answered questions in the Q&A, you can find the written responses for all of those. We had a comment, not a question, but it is good to let people know that anyone can develop an allergy to cold that can make being in colder water more difficult, including children. So I personally didn't know that. So thank you for sharing that, and definitely a good thing to keep on your radar. The next question is, where will we find the current health recommendations for centers? So I'm going to put that in the chat right now. And that is a reminder when you go to Caring for Our Children, and there is there's the signs and symptoms chart. Let me just send it right there. That breaks down the different symptoms that you may see in your childcare. I'm sure you've seen all of them. And what the kind of line is as far as it's okay for the kid to come to school right now versus they need to stay home. And I know I was able to talk to Brina and Becca yesterday, and Brina was mentioning, you know, we want to be looking at the behaviors of the kid and how they're presenting. You know your kids well, and so we want to be looking at those symptoms, but also looking, are they able to participate? Are they just wiped? So I'm sure someone else can answer that better if you want to jump in, but the chart to refer to is in the chat.
Well, I'll just weigh in, Molly, that again, this is a really important, we're not going to solve this today, and we want you to know that the pediatric healthcare community is right with you in the observation that pre-COVID, there was a lot of illness in your homes and centers, and that need for families to send sick kids for care is a social policy problem of our country and also of our state. So the idea that we don't have choices as workers for what to do when our kids aren't well is at the root of it, which we certainly aren't going to solve today. But the big observation in pediatric healthcare through COVID is about team-based care, which is the idea that childcare providers, nurses in the community that work in the public health system, and pediatric offices, medical homes that see children, have developed relationships by necessity through this pandemic. And we have to maintain that level of connection to have these hard conversations. Like who's sick? How do you define sickness? How are you gonna keep your centers and homes well, but also not, keep kids out for 14 days that have a lingering cough. So there's definitely a body of work here for us to do together. And I just, again, want to acknowledge it was not right before the pandemic. So getting back to that is going to be of great importance, and it's going to require some significant communication. And it also puts you in a really tough spot with families, which I know you've been grappling with forever, but I want to acknowledge that as well.
Okay, thank you, Prina. So the next one, for preschools where there is a nurse present who is in a medical reserve, medical reserve core vaccinator, is there a way to partner with the Department of Health to administer vaccine on site? So I'm definitely turning that one over to Monica.
That's awesome. that even exists. First of all, I think there's always a pathway forward, right? But the one thing we have to be mindful here, I don't know what type of preschool situation it is, so it would be worthwhile checking with CVD around if vaccines can actually be given on the premises. We've been told that certain child care centers can and others can't, and so that wouldn't really be up to us. That would be more of like a regulations question. But there's other creative ways of thinking about this. So if any clinic, regardless of whether they have a nurse on site that's part of the MRC, we can think about ways to bring vaccine to that space or to that community, even if it's in the parking lot. We do that all the time. So I would say check in with whoever from CVV your contact is to understand what the rules and regs are there. And if they say yes, then email me.
There is a request to provide the link for reordering tests for your program. So I'm just going to put that in the chat right now. And that's there. And we got a comment, the Y would be happy to host a clinic. So that's always good to hear. So Monica, I'm putting that in your brain right now. All right. So let's see. We tried to align our COVID policies more closely with VDH in May, and we quickly ended up with an outbreak of 10 cases among children/staff, and then 10 cases among associated family members. As a director, I have to work with my staff, who all have higher risk for complications from COVID, to develop our policies. We have a strict health policy for exclusion, but this outbreak caused us to close for 7 days of operation because of the impact of positive cases among staff. As a result, we no longer allow a child to attend if someone in the household is isolating until that isolation ends. And because we had just returned to normal operations after having to cancel groups of kids while majority of staff were out with a bad cold/virus. Upon reopening after the outbreak, we decided to return to universal masking indoors. Our staff review and discuss these policies regularly while getting input from families, and this is where we are at the time. We are short-staffed with no subs. I truly cannot imagine what you guys are going through. I mean, I think you have really had to face this pandemic with the least resources, but never getting a chance to stop and never having, the support and resources that a lot of people had. A lot of people were able to say, you know what, we're shutting down, nobody's coming in, I'm not going to work, I'm not doing anything. And you guys have really been there the whole time. And I'm so thankful for what you're doing. And I'm so sorry to hear about that. I think it is tough. It is really hard to figure out the balance of keeping people safe and being able to run your business and just finding that balancing act of how to get kids in care but have the staff available to do it. Like you said, when you don't have staffing and there's no subs, it's really, really tough. And I wish I had a great answer for that of here's an awesome idea, but I really don't, because it's tough. It's so tough.
I see Allison has, yeah.
I wonder if perhaps, like, I think that was a really hard situation, and I wish I had words to say I could make it better, and I don't, so I won't pretend that I do. But thinking about ways in which we could adapt, like, I understand you have a need, you have immunocompromised people on your staff, it sounds like. So I wonder if there's a need, if there's a way. You had that outbreak when we were having high cases, when transmission was high with Omicron. So I wonder if there's a way that you could use the surveillance report, which indicates whether our state is high, medium, or low transmission at any given point, to kind of help you with your team determine whether indoor masking is needed at your facility or not. Like, I wonder if there's tools. I understand what you're saying is that the state guidance right now feels too unrestrictive to you, but I wonder if there's something in between that where we could use the guidance of transmission levels or community levels to help you determine, well, when transmission reaches a low point, that maybe you test the waters with masks off then, but if we hit another period of high transmission, maybe that's when you do masks on. Or maybe you're completely content with the way you're doing it, and I'm trying to solve a problem that you're not looking for a solution, and that's fine too. But I just throw that out there, that if you want to problem solve, we're happy to try to problem solve other solutions. And so because we can't have a back and forth here, I just want to open the door to that. Our team would be happy to continue to look at other solutions if you want to work together. So I'll just leave it at that.
I'll also just add that, working with schools as well, is that there's been a lot of really like unique local experiences that people are having. And so many places, both childcares and schools, had to shut down in January with BA1. And then what we found is many schools and childcare that maybe weren't as affected during that time were heavily affected during BA2. And so that can feel very confusing because you think, well, like, why are we experiencing this now and other people aren't? And so, I do just reaching out to this team just to know that you're not alone and unique in your experiences. And it is so local, the way people are experiencing these as Omicron kind of comes through Vermont, and that it just can be really hard.
Thank you so much for both of those responses. I think what I've heard as a person who works directly with many programs in several counties is that May of this year was the hardest COVID month since the pandemic began. And it's kind of mind-blowing because we have thought for about a year now that it was sort of getting better, and that we were somehow headed toward endemic. And I think we're getting there. I really do. And I'm so glad that you all actually have the data that's accurate to speak to that. And it can be really demoralizing to think that we're headed out of it, and wait, I just had the hardest month yet.
I think you bring up a good point. May was really hard. Like in Epi, we talk about it all the time. Although we had some really good news in terms of hospitalizations, I think. In terms of us all knowing people, we said it was the month where we knew personally more people that had COVID than ever before. Like, there was more people with COVID. Luckily, they weren't ending up in the hospital. So I think disease was more mild in that sense. But as far as case numbers, and if we look at our curves, except for the steep peak of Omicron in January, it was our next biggest bump was that bump. So yeah, I'm not surprised that was our perception too. So I just want to echo that back, that's what we were feeling as well. But it is getting better, and that's the good news. So I will leave you with that.
Yeah, so we're getting close to time, and I'm thrilled that one of the pieces that is like right around the corner is the option for the youngest kids to get the vaccine. So always remember that you can reach out to this team, because this is just such a wealth of expertise right here. And I know that all the slides and the links don't provide all the answers, perhaps that we're looking for in this moment, but all the slides and the links will be on the Let's Grow Kids website, so you can access them, and you can always reach out directly to the Vermont Department of Health. And I thank you so much, health and safety professionals, for being with us today and sharing your expertise. And thanks to everyone else for joining us. I think we got to, oh, wait, oh yeah, we did. Yeah, thank you. I was gonna say, I think we got to all the questions, and then I see there are 3, but they're sort of more like people just saying, oh yes, I felt it too, we felt it too. So may it be the last crazy wave before our youngest kids can get the vaccine. And we will, I'm not sure exactly what the format will be, but we're hopeful within the next month, maybe even sooner, to come back and talk about those vaccines with you. So thanks everyone for making time today. And if you're an early childhood educator on this call, do check into the resources, and you can share these with your families, the families that you serve. Have a wonderful afternoon.